CAR T-cell revolutionized treatment in lymphatic malignancies. However, CAR T-cells are only in the infancy in myeloid malignancies. We treated few patients with AML with 821 translocation that expressed CD19 with our in-house. This is the flexibility story. But for most of the patients with AML, MDS, and myeloproliferative disorders, there is no CAR T-cell yet. No product approved, but also the clinical studies are only starting because the targets that we have on myeloid cells is much less efficient than the CD19 on lymphatic cells and the more off-target effects. So transplant is the way to cure patients with intermediate and high-risk AML. We have in the recent years some development in specific drugs against mutation, especially the FLT3 mutation, the KMT2A, so the menin inhibitors, and IDH1 and IGH2. But still, many of the leukemic patients, are not cured by these specific inhibitors, and we are now not all of them are approved in Europe, and we just add them now to the traditional induction therapy. So most of the AML high risk and for sure depend on transplant to cure them. Also, we have relapsing patients. We have a patient with primary refractory disease. So under advanced AML patient, we have few categories. It's either high risk or relapse or primary refractory or relapse after salvage therapy. And for this patient, we need transplantation. Now, the advantage of transplant nowadays that we have a donor to almost all the patients and in time, because we have really improvement in haploidentical transplant. So what we discuss in this Meet the Expert is to which patient to offer transplant, in which scenario, what drugs or medication to give pre-transplant, what drug we need to give post-transplant, is there donor lymphocyte infusion or hypermethylating agent or venetoclax or a specific inhibitor post-transplant maintenance therapy that the transplant will not, the disease will not relapse. The importance of minimal residual disease to transplant. So this is the whole field, to cover, but transplantation is really the hope for this patient with advanced AML in the current practice. Thank you.